What is up, viewers? This video will help us understand more about typhoid fever. So, what is typhoid fever? Typhoid fever is a life-threatening illness that is caused by Salmonella typhi. This bacteria can infect our intestinal tract and our blood. Typhoid fever is also endemic elsewhere in the Philippines. Cases as high as 8,000 from January to June 2019. Majority of the cases were male, ranges from 1 month to 99 years of age. So, let us find out more about this disease from these doctors.
So how will doctors diagnose typhoid fever in any individuals who has a history of travel from tropical and subtropical areas? Patients who present with fever for more than 5 days. Fever documented at 38 degrees with the following symptoms: headache, diarrhea, body malaise, abdominal pain, gastrointestinal bleeding, and changes in orientation confusion should be considered a suspect of typhoid fever case. What are the lab tests that we can do to confirm typhoid fever? Direct methods such as culture and isolation, PCR, without test. For indirect methods, antibody detection is also used such as Tubex, Typhidot, and Typhorapid. For the treatment of uncomplicated typhoid fever. For complicated typhoid fever.
These diseases are spread through sewage contamination of food and water, and from person-to-person contact. People who are currently ill and people who have recovered but are still passing the bacteria in their stool can spread the bacteria. Typhoid infections begin with the ingestion of contaminated food and water. The bacteria ingested will survive the passage through the gastric acid barrier and invade the mucosa of the small and large intestines and eventually produce toxins. Invasion of the epithelial cells will stimulate the release of pro-inflammatory cytokines, which in turn induce an inflammatory reaction. The acute inflammatory response causes diarrhea and may lead to ulceration and destruction of the mucosa. The bacteria then disseminate from the intestines to cause systemic disease and further the symptoms. The hallmark features of this disease are the most common complaints of the people with typhoid fever are fever and abdominal pain. Sometimes it could be accompanied with headache, weakness, loss of appetite, diarrhea or constipation, and abdominal discomfort.
Boil water before drinking. Cook food well and always use food cover to prevent flies and other insects from contaminating them.
Make sure to wash your vegetables and fruits, especially when you're eating them raw. Make sure to wash your hands with soap and water after using the toilet and before eating.
Avoid eating street foods. Always remember to clean up your surroundings. So remember the things to avoid
To beat typhoid!